Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today I'm going to continue with my at-home wound care series. So today we're going to go over how to change a wound dressing. But first, if you could smash that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So step number one, we want to prepare ourselves and our supplies. So where? We're going to choose a location in the home for the dressing change. So it should have good lighting, adequate space, access to running water, and a hard surface like a countertop, okay? We don't want to be using the floor or a bed. And it should be away from children and pets, okay? So this is your workspace. Then we want a good setup. So we want to turn on the lights, turn off any fans or close any windows because we don't want any dust, debris flying around us or getting into our wound, contaminating our wound. We want a garbage at our workspace and a clean countertop surface, okay? So you're either going to wipe it down with an antibacterial surface wipe or warm soapy water. Okay, and then we're going to prepare ahead. So place all of our dressing supplies that we'll need on our clean hard surface. So it's going to depend what type of dressings for the type of wound. So you're just going to carefully read the instructions either on the dressing packages or the directions that have been given to you by a healthcare professional. It is best if you're able to watch the dressing change put on and removed at least once before doing so yourself, but this is not a necessary step. Most dressings are easily applied if you just read the instructions. Step two is washing your hands. So you're going to wash your hands with soap and water because that is the best. So first we're going to wet our hands with lukewarm water, apply a small amount of soap to the palms, and you do need to remove any rings or watches that you're wearing. Next, you'll wash both palms, back of hands, fingers, both sides, and your fingertips. And I suggest singing happy birthday twice to make sure that you've taken enough time. Then you're going to dry your hands with a paper towel or a clean cloth and use that cloth to then shut off the taps. Now, hand sanitizer. So we can use hand sanitizer as long as it's 60% or higher in alcohol content to replace hand washing if your hands are clean and not visibly dirty. So if drinking water is not like clean drinking water is not available, we can use a hand sanitizer, but we do prefer to wash your hands with soap and water. So step three, we are going to remove and dispose of the dressing, okay? So if you have clean gloves, put them on and remove the old dressing carefully by lifting up gently around the edges and moving around the edges, lifting up that dressing. Just be careful to avoid causing injury to the wound or the skin around the wound. So we don't want to just rip off the bandage because I know sometimes people like to do that, just rip it off as quickly as possible so it doesn't hurt as much. But what we really want to do is just take our time, gently remove it, not causing trauma to the wound because we have fresh new tissue and sometimes that tissue does get stuck to the dressing that we're using. Now, if it is stuck, all you have to do is get it saturated with water, leave it on for a few minutes, and it will just peel off, okay? So once the dressing is off, we're going to look at the dressing and answer these questions. So did the dressing stay in place or was it lifting off the edges? Did it leak through? So the wound drainage, did that leak through? Was it comfortable to wear or should it be put on in a different way? Did it cause any pain on removal? Was there an injury to the wound or the skin around the wound when you removed the dressing? Any problems should be discussed with your healthcare professional. Okay. Then you're just going to dispose of the dressing into the bag, into the garbage bag that you had there. And if you had clean gloves on, you're going to remove them and also place those into the plastic bag. So since we were just removing a dirty dressing, we are now going to wash our hands again because we don't want to be putting on a nice clean dressing with dirty hands. So our next step is to clean the wound. So we're going to place a towel underneath the wound area to catch any of the liquid. If you do have clean medical gloves, you can put them on. Now for the cleaning, you're just going to pour the wound cleanser over the wound. Totally depends on what you're doing, whether you're spraying it on, whether you're squeezing it on. It just depends on what cleanser. Normally I use saline, which just comes in a bottle that you squeeze on. Another option is to put the wound under warm running water and wash it with a mild soap. Or you can, if you have gauze available, you can get that saturated and wipe through the wound. And you're just going to repeat this until the wound is cleaned. Okay. Now drying the wound. After cleansing the wound, you're going to pat the tissue around the wound. So it's called the peri-wound skin. This is the skin that's not open. It's not a wound. You're going to dry that off with either a clean gauze or a clean paper towel. Next, you're going to dispose of all the used gauze or paper towel into the plastic bag. Now that we have a clean wound, we can now assess the wound and the surrounding skin. So we're going to examine the wound and the surrounding skin, making sure that they are clean. And then we're going to use our chart. So it's on the next sheet, the next slide. Make sure you jot that down. And then you can fill that out, okay? So you're going to make sure you have the date on it and keep it for your records. So every time you do a wound dressing, keep one of these sheets for your records and take a picture each time you do a dressing change so you can track the changes over time, and you do have all of this readily available to your healthcare practitioner or physician if needed. Okay, so this is the chart that I was talking about in the last slide. So I'll give you a second to jot this down. You can pause the video, and these are just some questions that you should be asking yourself. Now, if things are getting worse, you definitely want to make sure that you're talking to your healthcare professional because things should not be getting worse. They should be getting better. So step 7, we're going to apply the new dressing. So first we have to open the dressing packaging, taking care not to touch the inside of the dressing because we do want to keep it as clean as possible. So you're going to hold the dressing by the edges and remove it from the package, making sure that it's large enough to cover the wound. So we do want at least a 2 centimeter overlap onto the good tissue, okay? And we don't want any adhesive actually touching the wound itself. So unless the dressing is self-adhesive, meaning it will stick to the skins because that's what it's meant for. And if it is a self-adhesive, you want to remove the film prior to placing on. Now the position. So you're going to position the dressing over the middle of the wound and gently press it into place. And then you're going to smooth it towards the edges, okay? Making sure that there's no gaps, no air where dirt might get in. Then we're going to clean up. So after using any equipment, so your forceps, your scissors, your dressing trays, you're going to wash them with warm, soapy, drinkable tap water or cleanse them with an alcohol wipe or antibacterial surface wipe, okay? If you do have your gloves on, you can remove them and put it into the plastic container. any garbage you can dispose of at this time. Okay, so you want to clean up your workspace. You want to sanitize it once again, wipe it down with your antibacterial surface wipe or with warm soapy water, making sure it's all clean for the next use. So step 8, this is where we're finishing. We want to wash our hands and make sure that they're nice and clean after touching our wound. So step 9 is just kind of follow-up questions after everything's completed. Just think back if you have any questions, concerns, if you answered any of the questions that the wound is getting worse. We want to review and assess, discuss with our healthcare practitioner, okay? If there's anything that's going on out of the normal, if you notice different colored drainage, if you notice a smell, if you notice any of those things that are new or getting worse, we want to talk to our healthcare professional. We also want to resupply. So check your supplies, make sure you have enough for the next few dressing changes. If you're starting to run low, we want to get in more supplies just so that we don't run out, because sometimes it can take up to a week for special supplies to come in. So that's all I have for this video of how to change a wound at home. And if you haven't done so already, if you could hit that subscribe button, it would be greatly appreciated. And I will catch you all in my next video. See you guys.